just from a dental point of view, then, why do you want your metal fillings out?
Yeah.
Forget about the ties to all the, or potential ties to all the diseases. Just from a dentist point of view, why do you want to have them replaced?
Yeah. Well, this is where I come in, and I see this a lot in my practice, where people come in with old metal fillings. They were placed usually when they're teenagers, when they're getting a lot of, cavities in the teenage years, and they used to, and they still do a lot, place the metal fillings because they're easy, they're simple, they last a long time.
They're cheaper.
And they're cheaper.
Right.
And the problem is, over time, those fillings, especially if they get a little bigger, start to weaken the teeth. They can actually start cracking the teeth underneath them, because your tooth is a living tissue. It's not. It bends a little bit. It flexes as you chew. Over time, the metal filling does not move. It's an immovable object, and because that little flexing, the teeth starts to develop cracks underneath the fillings. And those cracks can continue until the teeth weakens over time, and you could even get tooth breakage from that. A lot of people have had that happen to them. Once they hit a certain age, their teeth start breaking. They'll lose a cusp or something, and then they need a crown or a cap. It's very common, it happens all the time, and that's how people end up with a lot of caps and root canals, for instance.
Right.
And so over time, you don't want the fillings to get too old, because that usually means that it's weakening the teeth. After about 20 years or so that the filling's been in place, you can count that there'll be some the beginnings of tooth damage underneath the fillings.
Yeah, and you'd think, just from a kind of a basic point of view, that metal in a moist environment or whatever over time is gonna corrode. It's gonna, metal doesn't hold up too well over time when it's wet all the time, right? Is it that kind of thing? It corrodes and it.
Yeah, the mouth. There's wear and tear in the mouth. You're chewing on it all the time, and these silver fillings do look corroded when they come out. The old ones, they look dark, and the edges get kind of rough. You start get some leakage, and so they don't. A lot of times they look old when they come out. They do wear and tarnish, so to speak. There's other alloys that you use under crowns that don't really tarnish because they're alloys. They're cast,
Right.
so they wear better.
Now, a lot of dentists who are not holistic dentists will remove mercury fillings.
Sure.
If you ask them, right? I mean,
Absolutely.
I've got 12 mercury fillings. I go to my dentist, will you remove them for me? Whether he believes in holistic dentistry or whether he agrees, whatever side of the controversy he's on,
Right.
he'll take the job and remove your fillings if you want.
Absolutely.
Well, as a holistic dentist, or as a patient, why shouldn't I go to an average dentist to have my mercury removed? What?
You could. People, do that a lot. And I'm not saying that we do it better than any other dentist, or the dentistry is any better or different. What we do that's a little different is that we use certain precautions. I think it's good practice. I believe in it. It's better to be, safe than sorry. First, do no harm.
Right.
So what I do that's different, it's not so much the dentistry, it's the isolation of the teeth that we do when the metal comes out. The teeth are isolated from the mouth. You're protected from the dental work, from the metal, so that, for instance, it's not spraying into your mouth. It's called a rubber dam.
Mm-hmm.
It's very common. Any dentist can do this. So if you're interested or concerned about the metal coming out, and you may be absorbing, somehow some of that metal, you might swallow it. Who knows?
Right.
During the dental work, if you
The
don't
point
want
is
it,
to get it out of your body, right?
Yeah.
Not have little bits of it going down your throat or what have you.
right. The body can deal with a lot, but it's better to protect. It's just conservative treatment. So, if you go to your dentist and ask him, a lot of dentists will do this for you. Do the rubber dam piece because they know how to use that. It's very common. practice.
Right.
They use it for root canals. They can use it for anything.
They just might not normally use it to take out a filling.
A lot of dentists don't do it routinely because they've gotten out of the habit of doing it routinely. So a lot of dentists will say, well, we just don't do it that way. You know, some dentists will say yes, and some dentists will say no. I don't do that, you know, because they just don't.
Right.
So we do it routinely because we just believe in it.
Right.
As a routine practice.
Right.
There's other things that we do also. You know, we isolate, like we protect the nose from anything that's air, because when you're drilling out the silver, some of it gets in the air. It's
Right.
aerosol.
And it goes right.
You can breathe it in. The lungs are very efficient, you know. They're made that way. They're made to be efficient. So
Right.
we protect your eyes. You know, it's just simple things that can be done. We put sunglasses on. We have a big filtration unit that comes close to where the work's being done.
That filters the air right there.
That suctions the air away and filters it before it comes back into the room. That's a precaution.
Right.
I like that precaution also because it protects the whole room.
How do you dispose of the mercury when it's out? Is that different than in any dentist's office, or is that?
Yeah, a little bit different. Dentists have what they call traps, where they have like a screen. Any particles can be captured by the screen before it enters the water system.
Right.
Goes out of the office into the sewage system and all that. What we do that's different, not very many offices do this, from what I've heard, is that we have a filtration unit before it leaves the office that gets all the metal out of the water, whether they're chunks or dust or anything. So the waste that leaves doesn't have metal in the water.
You're not polluting
Right.
the ground or.
It's kind of an environmental issue that I believe in, kind of a green issue, and I don't want to be putting metal out there.
Right. It's just one of those things I think people don't normally think about. I mean, mercury is toxic, comes out of your mouth. When I leave the dentist, I don't think about how they're disposing of anything, and it's just it's very interesting. You take a mercury filling out, but with the water you use to rinse with and so forth, it's just going right out into outside
into the water system. Eventually ends up in the ocean or.
Okay.